camera turned off, turn it on. Okay, we still have 2 more people in the waiting room, all phone numbers.
Okay.
Marie, why don't you start? Let me call the meeting to order. Everybody, we're calling the meeting to order, the Tuesday, April 28th of the Regional Council meeting. Marie is going to take roll call and in particular ask people who are using their phone numbers who they are, so we have names. Then I will describe how we're complying with the open meeting law under these circumstances, which you might be curious with. And then we're going to go through the agenda. For those who've not used Zoom, let me quickly tell you that on the bottom of your screen, you should have a participant list. If you press on that button, a window will open up to your side. Your name will be there. Your name will be near the top. You will notice that everyone is muted. If you want to speak, at the bottom of that screen, you can raise your hand. When you raise your hand, a little blue hand will show up next to your name, and then we will be able to recognize that you want to speak. If you want to talk to each other behind the scenes, there's a chat button on the bottom. You can either chat with everybody, which I won't be paying attention to because I'll be too busy trying to run everything else, or you can choose particular people that you want to chat with, and so you can talk in class, and nobody will be the wiser if you're talking to individual people. We now have 34 people, and one more person is trying to get in. I just let them in. So without further ado, Marie, take it over. Everyone else stay muted, please, until you have to speak. In fact, maybe I'll unmute everybody just for the roll call because people will forget. So I'm going to unmute everybody now. If you've got dogs in the background or children or anything of the same, lock them in another room.
Another few.
Go.
Okay. This is the Regional EMS Council of New York City Regional Council meeting, April 28th, 2020. Please respond when I call your name.
It's REMSCO.
Dove Jacob.
Oh, really?
Yeah, I'm in REMSCO right now. So
Hello.
Please.
That's the
that's one
up.
Megan.
Wait, Marie. Folks, if you have to talk to someone, mute yourself. Okay, there are too many people, too much background noise. There is now 36 people here. Please, go ahead.
Okay, again, please answer when I call your name. Dove Jacob.
Present.
Ari Weiss. Was that a yes? Or that was somebody else? Okay, Grace Cacciola.
Grace Cacciola.
Lillian Bonsignor. Christine Mazzola. Bradley Kaufman. Samia McKeechin.
Here.
Allison Burke.
I'm on, Marie.
Thank you. Dominic Battinelli. William Goffin. Okay, Joseph Marcelino said he was actually sick, so hopefully he gets better soon. Daniel Mizels. Mordecai Goldfeder. Robert Bristol. John Johnstone.
Here.
Thank you. Travis Kessel.
Present.
James Downey.
Here.
Jerry Gelbard.
Present.
David Mikatansky.
Present.
Joseph Schenker.
I'm here.
David Benelli.
Present.
Wait,
Scott
David, why are you
Orland.
so formal on this meeting?
Excuse me?
I said, why is David so formal for this meeting?
I guess he's on his best behavior because it's council.
Don't worry, it won't last.
Okay, that's good. Scott Orlansky. Mordecai Lax.
Here.
Martina Barcarella.
Here.
Vincent Branco is here.
Right. Vincent Barranco is here, present.
Thank you. Nancy, I saw you. Nancy Benedetto.
I'm here, Marie. Happy birthday.
Thank you.
Happy birthday to you.
Happy birthday
Birthday
to you.
to you.
Oh my
Happy
goodness.
birthday, dear Marie. Happy birthday to you.
Are
Thank
you
you very
one?
much.
Are you two? Are you three?
Yeah.
Guys, we don't have enough time. Come on.
We don't have all night here.
Oh, really? Thank you. Art Cooper.
Yeah, I'm here.
Robert Krupe. Robert Krupe. Megan Farley.
Here.
Manfred Fuchs.
Here.
Sean Graves.
Present.
Jerry Gumbo. Yadidja Langsam.
Present.
Brian Levinsky.
Present.
Dennis Laurie.
Present.
Mitchell Powell. Mitch Powell. Okay. That's it.
Marie,
Okay.
Mitch is not on.
Mitch is not on? Okay. Okay, so we have a quorum.
Thank you.
That's it.
Okay. I'm not going to mute everybody because there's still a significant amount of background noise. People are flushing toilets or whatever. Okay, it's very noisy. So remember, if you want to speak, I'll still allow people to unmute themselves, but if you don't behave, I will not let you do that. So behave, everybody. Okay. Now, the first thing before we move any further that I think we need to take note of the fact that there are many members of our community who have given their lives to help the citizens of the city. And although this is a Zoom meeting is not the proper place to recognize them, I believe we should take a moment of silence for all the providers, nurses, physicians, and everyone who are the true heroes of our times working right now. And I know that after this, Marie is going to be setting up, already working on setting up a memorial page on the REMSCO site. And at some point, we will need to do something a little bit more formal than do it now. So let's take a few seconds, okay, to just think about the people who have donated their entire lives, okay, their lives, their very lives towards this. Moment of silence, please. Thank you very much. Okay, so let me just first tell you the rules that we're operating under. Normally, of course, we operate under the requirements of the open meeting law and Robert's Rules of Orders when it doesn't conflict. The governor has issued a statement, okay, a directive that allows meetings subject to the open meeting law to meet using technology, that is over phones, Zoom, and such other things. However, he did not suspend the need of a quorum. He did not suspend the need to allow the public to view what's happening. He did not suspend the need, and he expects us to record it. So first of all, this meeting is being recorded. So you can see that up on top. It says it should have a little thing there saying recorded. So be careful what you say. Number two is, since we have let anybody into this meeting, okay, because the link was published, I don't know if that's such a good idea, but it was done. Therefore, anybody, this meets the requirements of allowing the public to view it as it goes along. We do have a quorum, so we don't have to consider the ambiguous directive that we got from the Department of Health as to suspending some part of the quorum, but it's not clear what. So I don't know what the legal basis for that is. So anyway, so we are at this point having a legal meeting, and of course all votes will be done by roll call, as they must always be done. There's no such thing as a private vote. Okay, so the first thing on the agenda is the approval of the January 28th, 2020 meeting minutes. These were previously distributed. I heard before that we had a single correction on someone attendance. And are there any other discussions, corrections? Please raise your hand if you want to speak. Okay, remember you can do that from your participant list. Hearing no one asking to speak, I'll make a motion, or will someone make the motion? Just shake your head that we accept the minutes. Okay, unless I hear anyone voting no or abstaining, we will assume the minutes have been accepted as published. Thank you very much. The next thing on the agenda is the correspondence report. Marie tells me there is none. Marie, is that correct? Marie, unmute yourself.
We haven't really received mail. What we have gotten are the advisories that we've either received from the state or that we have sent out, and those are all public and have been sent to everyone.
Okay, and you'll include them, I think, in the minutes for,
Yes.
since we have so many people at so many different places. Okay, we're now ready for the staff report. Who's giving that?
That's me.
Okay.
Just let me pull up my paperwork. Okay, so where to go? Of course, it's not here. Okay, give me 1 second to pull it up again. Here it goes. Stupid dog. Okay.
Marie, do you have a?
Yes, I do. Just hold on 1 second. I have to go lock him up somewhere. Hold on a second. Just bear with me. Come here. Come here.
You did your while Marie's gone. Can I ask a question on the record?
Yes, you can.
How many people are wearing pants? Just curious.
Maybe that's why a lot of the cameras are turned off.
Yeah, maybe you can ask people to stand up.
Right, seriously. Everybody stand up.
Guys are really bad. I go away for 30 seconds.
Dr.
All right,
Schenker,
we're back, we're back.
Dr. Schenker, I can't even see you, actually.
I'm here. I'm next to Marie.
I don't know. It's weird. I can't see you.
Marie, Dr.
Okay.
John, Dr. Krupi joined.
Okay,
and
good.
Dominic joined. So you can add them to the attendance. Dominic
Okay.
Bagnelli and Dr. Krupi.
Let me give my reports quick, and okay, I'm reporting for Scott Chang for emergency preparedness, and he told me REMSCO is participating daily in calls with New York City Emergency Management and New York State Department of Health, and we are holding weekly calls with the different EMS sectors to provide situational awareness. And we are also collecting data on EMS sick rates. Numerous agencies have reached out to REMSCO last month, this month, and expressed difficulties in obtaining necessary PPE. Through coordination with the New York City Department of Mental Health and New York City Emergency Management, and also with the assistance of Senior Care EMS, the Regional Council has established points of distribution for PPE throughout the month. And PPEs were allocated based on an agency's call volume and an agency's self-reported burn rate. The pod distribution supported the region's commercial ambulance services, hospital-based services, and volunteers. We did not distribute to the municipal sector. In addition, REMSCO has worked with NYSARA District 4 and District 18 leadership in supporting the volunteer agency's PPE need in between pod events by providing caches of PPE to James Downey at Jamaica Estates, and Jerry Gelbart at Glen Oaks District 18. Agencies that could not pick up during the regular point of distribution were able to pick up from those locations. And we want to thank both District 4 and District 18 for their help. With regards to program agencies, we are hopefully going to be receiving two new two-year contracts. I'll be able to give you more information probably after the next meeting. As we were told before, New York City REMSCO, we created a page on our website to help the New York State Department of Health with its communications with the NAC ambulances, since New York State Department of Health was operating their revised HEC. And also REMSCO, we sent out surveys to all agencies. I think we've done 3 now, to ask for the sick and quarantine rate and the PPE burn rate. We use this data so that we can get more PPE and also to change the staffing standards if necessary. And that is the end of staff report for now.
Thank you. Is there a program agency update?
No, that was it. That was it.
Okay. There was no ambulance committee meeting. Okay, so now move to the, I'm gonna mute you, Marie, for now. No, you are muted. Who's making all that noise? Okay, we now move to the Training Education Committee report. Or do you want to unmute yourself, or should I unmute you?
Sure, I got it, yeah. So training and ed did not meet, although there were some conversations being had on the side. The Department of Health was having meetings with core sponsors to continue to convey what they're doing in terms of certification and recertification. All this correspondence has already gone out through various agencies, Department of Health, REMSCO, and so forth. And these meetings were there to help the core sponsors figure out how to facilitate continuing their classes, be it online, not online, and what to do moving forward. So that was addressed. We are going to be convening a training and ed meeting sometime in the next 2 weeks, because we have to come up with a plan to address the protocols, the protocol changes that were approved to be done regionally. I know that it's being delayed, but in the meantime, we haven't had any correspondence back from the state. So we're going to put some sort of game plan in place so that we can do it by distance learning. Considering the circumstances, we simply don't know what's going to be. So we're going to have to set up something distance, and we're probably going to try and model off of what we did for stroke. And that's all I got.
Thank you very much. Are there any questions for Morty on his Training Education Committee report?
I just want to add something.
Go.
Okay. With regards to our providers in the region, we are working with different agencies to get them on the health commerce system so that they can check on the certifications of their employees or prospective employees. And the state has extended everybody for 1 year. Our REMAC has also extended our paramedics for at least a year. And we posted on the website all the different things that can be done based on whether you're expired or not expired. So if you need information, we have a COVID webpage that's got all this different information and links on it. That's it. Thank you.
Thank you. I assume Dr. Schenker is the one giving the REMAC report? Oh, a minute, Dr. Schenker, okay. You're still muted.
Well, that's because you keep touching it. Stop. How about now?
You're on.
Excellent. All right, so let's just do this. This one. Okay, for those of you who are on the computer, I am now sharing the report, and I will go through it. Okay. So we met, the REMAC met, not the REMSC, but the REMAC met on April 21st via Zoom. We did have a quorum at that time, and we operated under the same meeting laws that you described. Dario Gonzalez gave a report as to the Javits Center, which has been underutilized considering the 4,500 beds that are available there between the Javits Center and the Comfort. The Comfort, as you all know, is preparing to leave port and head back to to its home base. The CNC committee is working. There should be coming up shortly, and there will be announcements about this, a credentialing exam for medics that have never credentialed as regional paramedics, meaning they're New York State certified, but not REMAC original certification. That's the one window that the extension doesn't really apply to. So that will be prepared, and there will be an appropriate exam with social distancing and all the different components that are needed for testing. Okay, so there was a lot of advisories that went out since we last met. I will go through this, and then we'll go through, I don't see Marie, do we have the, I don't see it here. These are all the advisories, but where's the protocol changes? Oh, here we are. So termination resuscitation guidelines were revised. A version is going to be sent to CMAC for approval. Essentially, this is a guidance for online medical control physicians as to when the evidence suggests that termination of resuscitation is appropriate. This is not COVID specific. This is general. And there are some simple protocol corrections with regards to the amount of epinephrine that we give that will be sent to CMAC as well. These changes were voted on and approved at REMAC and just need to be, this body needs to be notified about them. The termination of resuscitation guidelines that were sent out have since been rescinded by the state, but before that rescinding, New York City realizing that we didn't have a need for it, decided that we weren't going to use those very aggressive crisis standards. I want to kind of quickly go through advisories that have been sent out since we last met so that you guys have an understanding of what we've done. So there was a COVID virus advisory that was sent out. This was an informational document. It was sent out in, I believe, late January, early February. The unified protocols were sent out. This is in, I'm sure you guys have seen it. We did vote at, somebody, did I bold that? I don't know. We did vote at not this past meeting, but the meeting before, and then reaffirmed it at our last meeting that we will update to the unified protocols in January of 2021 rather than July. And this is because the fire department is doing some on-site practical stations that we will not be able to do with the current COVID situation. There's been delays because of it. So that is, we voted to, and we have to send it up to the state to allow for a January 2021 implementation date. The REMAC advisory for nebulized medications went out, advising to use a BAN over nebulized medications. This continues to be in effect and is best practice. Nebulized medications, even though we're seeing less COVID patients, should not be done unless necessary, unless there is no alternative. A COVID PPE advisory was sent out, an advisory about alternative airways that can be used in all patients at the discretion of medical directors went out. The extension of the paramedic protocol, paramedic credentials, this is in line with what the state sent out. We did send out a temporary lowering of staffing standards for the 911 ambulances. This was never implemented. So 2020-08 is an advisory to temporary cardiac arrest standard of care for disaster response, which precluded transporting patients that were in cardiac arrest, not to transport them with CPR in progress. That still is in effect. As part of a phased, normalizing of our standards, that probably will be terminated on Friday. But that is, again, depending on the volume, depending on how things go, that's how we'll decide when we're going to do that. So that is this 2008, 2020-08. 2020-09 was a viral triage protocol to triage people out and not transport them. That advisory was rescinded yesterday, I believe. 2010 was the temporary cardiac arrest standards from the state, which we immediately clarified and stated that we were not going to use that that standard. And that brings us to the end. We will be reviewing triggers on a regional level as well as on a statewide level of when various disaster levels need to be implemented. So that will happen, and we're working on that right now. And that concludes the REMAC report. I'm going to stop sharing the document, or actually, you know what? I'll leave the document up if anybody has any questions, and then I'll stop it after that.
Well, I can't see. Hold on a minute. Does anybody has any questions? Okay, no one seems to be raising their hand, and I certainly can't see anyone's video. So why don't you stop sharing the document so we can get our screen back? There we go. Okay. So we now have 38 people at the meeting. Marie, I don't know if you noticed. I think Scott Jank showed up, came into the meeting. So Scott's here as well. Okay. So I'm hearing no questions on that. Thank you very much for the REMAC. Is there a QI report?
There was no QI meeting. There was a discussion at REMAC about the what metrics we might want to look at in the setting of COVID as part of our quality assurance initiatives. That will be worked on. There is a plan for a QA meeting that will be in the next week or so to discuss this further.
Okay, Jerry, you have a question? You go ahead. You can unmute yourself. Are you muted? Jerry Gilbert, you have your hand up. You want to speak?
He might not be able to unmute himself if he's on a regular phone. You might have to unmute him.
I gotta find him. That's the problem because he's okay. He seems to be off now.
Yeah.
Okay, go.
No, he's right here.
Oh, Jerry's right there on the bottom. I see him. Okay.
Just unmute everyone for a second and maybe he'll be able to speak.
Okay, I'll unmute everybody. Okay, but please, let's keep it down. Everyone's unmuted.
All right, that did it. The question's for Dr. Shanker regarding 2020-06 REMAC credentialing. Who will be the POC that's responsible for replying and providing the confirmed documentation on those paramedics, either to them or the agency?
That's Kevin Ward. I can answer that. Kevin Ward. He is the REMAC liaison who's actually.
Hold on, Marie. Let me just clarify one thing. We are not going to be sending out new cards. Okay. From a regional level, we are not sending out new cards. We know that no cards have gone out since this has started, so we will be able to just assign an extra year. And Kevin Ward has done that in his system. And he's the fire department REMAC liaison.
Correct on that. We were just looking for a reply to the emails that were sent because we have not gotten any reply to any emails requesting.
What are you requesting exactly?
The documentation in accordance with 2020-06 was sent in to Marie, forwarded to Kevin Ward. No reply has been coming out of that REMAC liaison.
Documentation of what? I'm sorry, Jerry. I don't really understand.
Can I answer this?
Sure.
Jerry, I did speak to Kevin and I actually communicated with Dr. Krupe. Kevin said that he had responded almost immediately to reinstate yourself and the other paramedic. I don't understand why you haven't gotten it. I did communicate that also to Dr. Krupe. So I'll speak to Kevin again, but check your junk and spam folder to
Yep.
see if maybe it went there, because he did respond to you. He's pretty much keeping on top of this.
Yep, we checked, not here. We just wanted to know what method we're using to confirm that that's done, rather than, obviously we know no cards. We just wanted a document to post in the personnel file.
Yeah, you'd be getting an email. Each paramedic will be getting an email saying, yes, you are extended. So if you didn't get it, I'll speak to Kevin again and have him send it to me, and then I'll forward it to you to see if that's a problem, maybe.
Okie doke, thank you.
No problem.
He has his hand up.
Yeah, I was just going to say, Marie, maybe we can update that on the website also, on the listing on the website that has the credentialed medics. That might be valuable for the agencies to go look up the people.
That's a good idea that I didn't even think of, and I will do that.
Thank you very much. Are there any other
There's Morty around.
on this? Okay. Hearing none, let's move on to the next item. State EMS Council report.
There is no report because we haven't met. The last meetings were canceled.
Exactly.
And the next meetings, I think, are going to be in June. They haven't canceled those yet.
Okay, Marie, do you have any unfinished business?
No, not really. I mean, we've been very busy. We've been doing many different things to support EMS during this crisis. A lot of you have seen and dreaded all the advisories that we've sent out. And we're trying to pass on information from the New York State Department of Health regarding education. If there's anything that we have not, caught on that you think we need to be dealing with, let us know. Send us an email, and we'll try and deal with it with the best way we can.
Okay, thank you. Does anyone have any other unfinished business? Hearing none, does anyone have any new business? Well, hearing no new business, again, as I like to say, take a look at your watch and see how we ended this meeting. The meeting is recorded. Marie, you're going to get a link, an email. You have something?
I just wanted to remind everyone, we have a memorial wall. We have a thank you page on our Facebook. I've been trying to take memorials off of Facebook, and I'm not tech savvy. So if you know anyone who has passed away, send me a picture in an email with the text. And I'm asking, Joe is helping me because he's a lot better on the computer than I am, to actually post this. We want to put something up to remember all these people that have given their lives for, to help us in the field on the front lines. And that's it. I have nothing else.
Thank you, Marie. Okay, so before we all go, again, I just want to tell everyone and remind everyone to please take care of yourself. These are very dangerous times. I don't need to tell you this. But if you are actually quarantining yourself, as some of us older people are in between, you gotta stay sane as well. And keep your mental health as well as your physical health going. Thank you all for doing this.
Marie, if you don't mind, if I could just bring up one point before we close.
Yes,
Who's that?
go ahead.
Travis Kestrel, District 4. I do think we need to acknowledge amongst all the members we lost to COVID and all the other EMS providers that there has been a provider suicide this week and a physician as well from Columbia. And I think that obviously in the current times we have our focus on the COVID crisis, but we need to take a look at provider mental health and what services we can offer as a regional council, but also within every single agency, because this is something that is wearing on people, not only with the physical symptoms of the condition, but the providers are being burnt out at an incredible rate. And unfortunately, it's manifesting in really terrible ways right now.
Indeed. Thank you very much for raising that issue. Anyone else? Well, in that case, thank you. Have a good evening. And we will end the meeting. Stay safe, everyone, until we see you next time, hopefully in person. Bye.
Okay.
Thank you.
Thank you.
Stay safe. Thank you.
Thank you. Bye-bye.
Marie?
Yes?
Happy birthday.
You want me to call? Oh, thank you.
Birthday again.
Happy birthday to me.
Yes, indeed. There you go. Birthday too. I'll drink with you.
Oh, God, I wish. I can't wait.
Happy birthday, Marie.
Thanks. Bye-bye, everyone.
Bye.
Bye.